Welcome to Medication Administration Training, Module 5. Regulated medications. Narcotics and controlled medications. Narcotics are prescription medications commonly prescribed for moderate to severe pain. Examples include acetaminophen with codeine, Tylenol 2 or 3, Percocet, or morphine. Controlled substances are medications listed under Canada's Controlled Drugs and Substances Act. Examples include Ritalin, benzodiazepines, clonazepam, lorazepam, or barbiturates. It is common for residents that we support to be sometimes prescribed controlled medications. And it is also important when dealing with controlled substances that quantities are kept to a minimum and that they are securely stored and handled. Oftentimes, these medications are double locked, for example, in a locked cabinet in a locked room. All staff must check for completeness and accuracy of the records they are responsible for and immediately resolve any discrepancies. Medication counts. All PRN medications should be counted at the beginning of each shift, 8 a.m. and 8 p.m. Any discarded medications need to be listed and accounted for prior to sending back to the pharmacy. Medication counts may be implemented for discarded medications, for example, narcotics or controlled substances. Here is an example of a completed medication count log. This should be completed at the beginning of every shift, and staff must document immediately anytime a PRN is administered and/or discarded. Each medication is to be documented on their own. Here is an example of a discarded medication form. This form is to be completed if there are any medications that need to be discarded. For example, dropped medications, refused medications, or if they have been discontinued completely. The medication will be counted, entered, and signed by staff with the reason for discarding identified. These medications will be returned to the pharmacy as soon as possible by an RM or senior group home counselor. A staff can be designated by an RM to do this. When returning medications, the pharmacy must sign the form to confirm they have received the medications. Discarded medications must be counted until they have been returned to the pharmacy. PRN medications. PRN medication used only as necessary. All PRN medications require a prescription from the healthcare provider. This includes all over-the-counter medications, Tylenol, allergy medications, creams, etc. Do not administer any medications without a pharmacy label. In all cases, PRN guidelines protocol are required for prescribed medications from a healthcare provider prior to administering a PRN. Any guidelines are to be documented on a medication change form. Detailed guidelines to be outlined for all behavioral PRNs. A behavioral PRN is a chemical restraint that requires a doctor's order. There must be behavioral guidelines from a BMS indicating preventative and de-escalation strategies. Should be used as a last resort only and to control a behavioral emergency. Least restrictive interventions must be used first. Any restraint is not to be used as punishment, to compensate for inadequate staffing, or for the convenience of staff. It is important to remember that every effort should be made by staff to avoid unnecessary use of behavioral PRNs or restraints, and should therefore try to redirect and diffuse problem behavior before it reaches crisis proportions. How and when to administer should be outlined in the behavioral guidelines. How early this will be administered is on an individual basis. Never administer a behavioral PRN without first reviewing the guidelines. Behavioral PRN guidelines and protocols. A PRN protocol is typically developed with team work location input and must be signed off by a prescribing medical professional. When reviewing any behavioral PRNs with a psychiatrist, ensure you bring the BMS program outlining all de-escalation techniques. The written protocol must include the following: name of the person the PRN is prescribed for, name and dosage of the medication, what the PRN medication is for, details as to what factors are to be present observed prior to administering the PRN, minimum length of time between dosages, maximum dosage, and a signature of prescribing medical professional title and date of signature. Documenting PRN medications on MR sheets. Following administration of any PRN, write the time and your initials. Any squares not used for a day leave blank. Administering staff must also advise incoming staff verbally that a PRN medication was administered and write a note in the communication log. Incident report must be completed for any behavioral PRN. Here is an example of how to document a PRN on a MAR sheet. Please note the time of administration must be identified on the MAR sheet with the staff's initials below. Please remember that you would also need to document on the med count log for this medication. MAR sheet etiquette. It is important that all MAR sheets are kept as legible as possible to ensure staff can read and avoid medication errors. MAR sheets are legal documents. No notes or messages to other staff are to be recorded on the MAR sheets. Do not erase or use whiteout. All signatures, recordings, and any other information in the body of the sheet will be recorded in blue ink, never pencil or red ink. This is to allow visual consistency and to ensure that we know it's an original copy. MAR sheets are to be filed at the end of each month. If you do make an error, put a line through the error and initial. Do not delay documentation. Ensure staff initial immediately after administering medications. Next, we will complete practical work in medication documentation, where documentation of medication changes on the MAR sheet, and will complete a review test. Practical exercises, medical appointments. The following practice examples will guide you through 3 separate medical appointments for a resident. It will show you how to document medication changes on a MAR and a medication change form and MAR sheets following each doctor's appointment. It is important to remember that after any medical appointment, including an ER visit, there may be further follow-up appointments required with a family doctor and/or psychiatrist. It is mandated by NL Health Services that MAR sheets are generated by a pharmacy for each resident. It is also important to note that when new medications are prescribed or any changes are made, a pharmacy will send a new MAR sheets with the new medication. You will not be required to handwrite medications on a MAR sheet. The following exercises are to ensure you understand medication changes and how to properly discontinue medications when changes occur. Medical appointment number 1, visit to hospital. On December 11, 2018, staff accompanied John Doe to the hospital for an emergency visit. As per the medical appointment summary, visit for the ER was due to increased incidence of aggression and verbal reports of painful urination. The doctor prescribed John a new prescription of olanzapine 10 milligrams, take 1 tab twice daily at 9 a.m. and 5 p.m. for aggression. He was also prescribed antibiotic amoxicillin 500 milligrams for possible UTI. Take 1 cap 3 times a day until finished for 10 days. Urinalysis to be completed at home. Here is a completed medication change form reflecting the medication changes at the hospital appointment. Please note the new medication section is checked, as he was prescribed a new medication at this appointment of olanzapine 10 milligrams. Take 1 tab twice daily at 9 a.m. and 5 p.m. Note the temporary med section was also checked. Amoxicillin 5 milligrams, take 1 cap 3 times a day until finished for 10 days. Note a specific start and end time is documented when there's a temporary med prescribed. This form is to be used for reference when making changes to the MAR sheets. This form must also be placed in the MAR binder so that staff can check these changes when administering medications. Here's a completed MAR sheet for the medications prescribed at the hospital appointment. The first label has the name of the medication, olanzapine 10 milligrams, and how to administer. Take 1 tab twice daily. The admin times are documented under hours as 9 a.m. and 5 p.m. as indicated on the med change form. The start date of this medication is December 11th at 5 p.m. Note there is a line drawn through the first days of the month with the arrow indicating the first day the medication is to be administered. December 11th, the day of the appointment. The second label shows how to document the antibiotic prescribed, which is amoxicillin 500 milligrams. Take 1 cap 3 times a day for 10 days. Temporary medication must be identified on the label. Note that admin times are 8 a.m., 4 p.m., and 10 p.m. This was not identified on the med change form, but it is a good practice to ask the doctor what times to administer so they can give you the correct times based on the resident's routines and existing med times. There needs to be a clear start and end date documented. Note the start date, December 11th at 4 p.m. and the end date, December 21st at 8 a.m. It is important to count the days several times to ensure accuracy prior to documenting. Lines are to be drawn on days the medication is not to be administered. Starting at 8 a.m. admin time, a line is drawn across with the arrow to December 12th, as this is the first date this medication is given at 8 a.m. Because the med will be given for 10 days, you would count across 10 days until you reach December 22nd, which would give you the end date for this admin time. A line would be drawn across to the end of the month. This would be done for each admin time. Notice that the medication was first given at 4 p.m. on the 11th, so you would count across 10 days until the 21st and draw a line across until the end of the month. This would be also done for the 10 p.m. admin time. Medical appointment number 2. Follow up with the family doctor. On December 15th, staff and John visit his family doctor for results of the urinalysis. The urinalysis did indicate infection, and the doctor said to continue with antibiotics as both the resident and staff reported no further pain when urinating. The doctor recommended to decrease olanzapine as aggression had subsided and could have been associated with the pain. Olanzapine 10 milligrams was decreased from 1 tab twice a day to half a tab daily at 9 a.m. Follow-up appointment with psychiatrist to be scheduled in a couple of weeks for a medication review. Here is an example of a completed medication change form based on the medical appointment with the family doctor. Note the decreased medication section has been checked to indicate the decrease in meds recommended by the doctor. Olanzapine 10 milligrams is decreased from 1 tab twice a day to half a tab daily at 9 a.m. Here is a completed MAR sheet reflecting the changes from the appointment with the family doctor. When a medication is changed in any way, increased, decreased, or discontinued completely, the old label must be discontinued. As noted, the discontinuation date is December 15th, the date of the appointment. It is important to ensure this is completed so that incoming staff are aware of the changes and they do not sign in error. The new label reflecting the new prescription has been documented in the next available space under the antibiotic. Olanzapine 10 milligrams, take half tab once a day, 9 a.m. is documented under the hours, and a line is drawn across to the start date of December 16th, the day after the appointment. Please note, these are practice exercises for you to understand how to make changes on a MAR sheet. When the pharmacy receives the new prescription from the doctor, they will send a new MAR sheet with the new label identifying the new prescription. In this case of olanzapine 10 milligrams, take half tab once daily. Therefore, you will not be required to write this into a MAR, but you will always need to fully understand how to discontinue an old label when a prescription has been changed. For example, olanzapine 10 milligrams, take 1 tab twice daily, must be discontinued in order for the new label to begin. Medical appointment number 3, the follow-up with the psychiatrist. Staff accompanied John to follow-up appointment with psychiatrist on December 26th to review medications. The psychiatrist recommended discontinuing olanzapine 10 milligrams completely as the resident was not presenting any aggression since December 15th. She booked a follow-up appointment to review and assess behaviors on an ongoing basis. The staff are to continue documenting any behavioral incidents and bring a summary of the data collection from the BMS at the next appointment. Here is an example of a completed med change form for the med changes at the psychiatrist appointment. Note the discontinued medication section has been checked and it is documented as being discontinued. Here is a completed MAR sheet for the medication changes at the psychiatrist appointment. Olanzapine 10 milligrams is discontinued completely, and a line is drawn across to the end of the month. Discontinue date is December 26th. Operational standards for medication administration policies. Medication policies will be reviewed as part of a staff's orientation and reviewed regularly with permanent staff. New policies are to be reviewed by staff immediately upon hire in their orientation to CRSB. New staff are trained on medication administration and complete observation testing by designated medication-trained staff. Staff are to prepare each resident's medications immediately prior to administration and administer only medications which the individual employee prepared. Staff report all issues of concern to the pharmacy, physician, or nurse. Observation testing checklist. Staff must complete observation testing checklists with the designated medication-trained staff prior to completion of medication training. New staff must watch medication-trained staff administer medications using the checklist. Then a medication-trained staff watch the new staff administer 2 separate times. Observation testing checklists must be completed on ShareVision. New staff are not able to administer medications until observation testing checklists are completed. Here is an example of how to find the observation testing checklist on ShareVision. New staff must get into this form through their ShareVision login. Note it is under Residents, and on the left-hand side you will see Medication Administration Checklist. This form will need to be completed 3 times. The first checklist will need to be completed by the med-trained staff when new staff observe the med-trained staff doing medications. The second medication checklist will be completed when med-trained staff witness new staff complete medications. The third checklist will be completed when med-trained staff witness new staff complete medications for the second time. The third observation testing checklist we'll send an email notifying completion, and this will be updated on the new employee's HR file. The new staff will then be considered officially med-trained. We will now recap the most important reminders to ensure safe medication administration practices are followed by all staff. For one, the 7 rights of medication administration. Always use the 7 rights of medication administration to ensure you are giving the right medication to the right resident, the right time, for the right reason, and document right away. Use 3-check method when administering medications, meaning cross-reference labels 3 times. Ensure to check the label on the MAR to the label on the blister pack to the medications inside the blister. This must be checked using the 7 rights 3 times. First, before preparing medications. Second, when preparing medications. And third, prior to locking the meds back up and administering to the resident. Do not punch medications out of a blister without ensuring your first checks of the labels and blister has been completed. Ensure you have a quiet space and quiet time to administer medications. The onus is on you personally to find the quiet opportunity within the administration window to administer medications. Inform both residents and coworkers that you are now doing medications and need undisturbed time to do this. Close the door to the medication room if possible, or have a coworker engage residents elsewhere to ensure quiet time. Documentation reminders. Sign off medications immediately. This must be done after each resident. Complete medication counts at the start of your shift before administering any medications. Update counts after you administer any PRN. Read ShareVision prior to administering medications. It is your responsibility as the person administering meds to ensure knowledge of all relevant info. For example, any med changes, appointments, or new medications, etc. Pharmacy contact. The pharmacy is a great resource for information. If you have any questions, contact the pharmacy, 811, or healthcare provider. If medications are not administered during administration window, as a staff person, you are not authorized to make a decision on next steps. Example, whether to administer medication or not. The pharmacy must be contacted regarding any incident in which a medication is not administered within the time window. Follow pharmacy instructions and document in a medication incident report. It is important to remember you are authorized to administer medications within the administration time windows. For liability reasons, a pharmacy must make all decisions regarding any time a medication is not administered as prescribed. This concludes the medication administration refresher training. You will be required to complete the final test for Module 5 at the end of this slideshow. This can be located on ShareVision in the training section.